At home with your newborn, suctioning the nose. You may use nasal saline drops and bulb suction anytime your child has a runny nose or congestion. It is best to suction your baby's nose before a feeding or at bedtime. Supplies. You will need bulb suction, nasal saline drops, which can be bought at any pharmacy without a prescription. They help thin the nasal mucus so that you can then use the bulb suction to remove it, tissues, or burp cloth. Bulb suctioning. Wash your hands well before and after suctioning. Lay your baby on his back with head position facing the ceiling. Have someone hold your baby in this position or swallow your baby in a blanket with arms at his sides to keep him still. Drop 3 to 4 drops of saline solution into each nostril. Hold the baby in this position for 1 minute. Use your thumb to push all the air out of the bulb. Place the tip of the bulb into a nostril until the nostril is sealed. Slowly release the thumb, letting the air come back into the bulb. This will pull the mucus out of the nose and into the bulb. Remove the bulb from the baby's nose and squeeze mucus out of the bulb into a tissue. Repeat these steps on the other nostril. You may need to suction each nostril several times to clear all the mucus. Gently wipe the mucus around the nose with tissue to prevent skin irritation. Clean the bulb syringe after each use with warm, soapy water and rinse thoroughly. Wash your hands when finished. Tips. Avoid suctioning after feeding. This may cause your baby to vomit. Your baby may cry, cough, or make gagging-like sounds. This is okay. The saltwater drops won't harm your baby. They are likely to sneeze them out or swallow them. Do not suction more than every 2 hours. You may see your baby's nose bleed if you're needing to suction often. Small amounts of blood are nothing to worry about. Hold and comfort your baby when finished. They will be happy quickly. If you don't have saline drops, you can make your own at home using the recipe at the end of this video. When to call your baby's doctor. If your baby develops a fever of 100.4 or more. If your baby is not feeding well. If your baby appears dehydrated, if the inside of the mouth is dry, if the baby is more sleepy than usual, or if the baby is not making as many wet diapers as usual, if symptoms are not improving after 2 to 3 days. When to go to the emergency room. If your baby is working hard to breathe, sucking in his stomach under his ribs, or using neck muscles to breathe, suction the nose right away. If this is not helping, go to the emergency department. If your baby is congested, and you have further questions or concerns, call your baby doctor's office. Recipe for nasal saline drops. Add 1/4 level teaspoon of salt to an 8-ounce cup of warm water. Stir to dissolve the salt. Keep the solution in a clean, covered jar. Discard the solution after 1 week.